Plantar fasciitis is one of the more tricky diagnoses that we see in physical therapy and is quite painful for the patient, but there is a lot that you can do. Welcome back, everyone. For those of you new to my channel, my name is Michael O'Connor. I'm a doctor of physical therapy and I've been practicing orthopedic manual physical therapy for over 25 years. Today I want to share with you some of the knowledge that I've gained and the techniques that I help patients gain quick relief from this challenging diagnosis of plantar fasciitis. In this video, I'll cover specifically what it is, and then I'll explain why it's so difficult to conquer this diagnosis of plantar fasciitis. And then I will give you a specific step-by-step process that you can implement today, right away, to start getting relief. And stay with me to the end because I'm going to share with you the #1 stretch that I used to get patients over the hump and eliminate their plantar fasciitis. And most of the time when I gave this stretch, just about every patient said, I've never seen that stretch before, so I'm happy to share it with you today. Let's take a look at the specifics. So what is the plantar fascia? The plantar fascia is a dense connective tissue structure that attaches on the bottom of our foot. It attaches right near the heel bone and it runs upward toward the toes. And connective tissue is, again, thick and fibrous. It doesn't contract and relax like a muscle does. Connective tissue is designed to provide support. It acts almost like a spring at the bottom of the foot to absorb our body weight and any impact that we apply to it. So there are some things that can happen that can inflame this structure and irritate it. One of the things that directly impacts the plantar fascia is an injury. So if you came down hard, landed, and you can actually tear the plantar fascia, it's rather rare because it is such a strong, dense structure, but you can actually tear it if the impact is hard enough on the plantar fascia. Most of the time, what causes the chronic plantar fasciitis is small, irritating micro tears that occur for a couple different reasons. One of the primary reasons is chronic tightening on the bottom of the foot. Once that structure shortens up and tightens, it doesn't have as much spring, and any additional load can actually cause inflammation and irritation. And interestingly, most of the plantar fasciitis cases that I've worked with have a problem with some secondary surrounding tissues, such as tightness in the calf along the back of your lower leg, or possibly weakness on the front side, your shin muscles, that don't allow your foot to lift up as much. If there's tightness on the back side, every time your foot comes through, you're going to heel strike a little bit harder and in the same location than if you had a good flexible calf that allowed enough what we call dorsiflexion and plantar flexion. If you have weakness in the front of your shin, same issue. You can't lift your toes as you're swinging your legs through. And that increases the impact force on your heel, which can obviously cause those micro tears and chronic inflammation and irritation. So there's a couple reasons why it's such a difficult diagnosis to overcome. First and foremost, once it's irritated, remember this is a dense fibrous structure on the bottom of the foot, it can take a lot of punishment. Once it's inflamed and irritated, that means it's usually been through a lot already. So if there's irritation on the bottom of your foot that has been initiated, now this is where we walk every day, heel strike in the same location. So it's difficult to heal because it doesn't get a chance to rest. We have to walk, we have to get up and down from chairs, and we walk stairs and do our normal activities of daily living. Another challenge is if your foot biomechanics are off. Some people have a rather flat arch, and the flat arch can chronically impact the plantar fascia. Or maybe you have a very high arch and it's not as flexible as it needs to be, and that can also cause irritation and inflammation. A high arch needs a little extra support in the shoe wear. And finally, the structure fascia, which is all over our body, does not have the same blood supply as muscles and other structures. So when there is an injury, there's not as much blood to go and heal the area. So that can also make it a more chronic condition. Okay, the plantar fascia is now irritated. What do we do? First thing you want to think about is be gentle. Remember, this is the bottom of your foot. You have to walk after you perform some self-treatment techniques. Most of the cases I worked on, a gentle approach was much more effective than aggressive. If you aggressively treat the bottom of the foot and you inflame it further and then you have to continue to walk and weight bear, it can set this into a downward spiral of more problems and more inflammation. So be gentle. The second thing is be consistent. Remember, the plantar fascia is a thick connective tissue fibrous band. It takes a little time to get it moving again. So be consistent. Listen to your body. Make sure you avoid any signs of pain or worsening, and gently keep being consistent with your exercise program. Remember, one of the main reasons we get the plantar fasciitis diagnosis is by tightness in the back of the leg, in the calf region. So we want to do 2 different stretches to address both muscles of the calf region. The first one is for the gastrocnemius. So you're going to just gently come up to a wall and bring the one foot back. Make sure the heel can touch the ground. If it can't, bring your foot a little closer. Heel stays on the ground, and you're going to just lean toward the wall nice and gently. My front leg has my knee behind my toes still, and I'm feeling a stretch in the upper calf region of my right leg here. About 30 seconds on the hold, and then we come out of that. One thing to note when you're doing a calf stretch, when you bring your foot back, the normal pathway that your leg wants to take will look something like that, where your toes come to the outside. You don't want your toes pointing outward because that's going to stretch the most flexible part of my calf. So make sure your toes, your heel and your toe, are pointing forward, straight ahead. Here's a side view of the standard calf stretch. Chair for balance, stepping back with my right foot. My heel stays on the ground. My left foot, my knee is not drifting over my toe. It's in good alignment. But I'm going to slowly bend that left knee, keeping my right heel on the ground and making sure I feel the stretch in the upper part of my calf. So that stretch gets the upper part of the calf, called the gastrocnemius. We want to stretch the lower part of the calf down near the Achilles region. And to do that, we're going to again stagger the feet. And you'll notice my back toe is kind of close to in line with my heel of my left foot. Here, we're going to make sure, again, the right heel stays down on the ground, but I'm going to just bend both legs gently until I feel that stretch in the lower part of my right Achilles area. That's the lower part of the calf, called your soleus muscle. About 30 seconds on this stretch, breathing comfortably and coming out. A view from behind, wall for balance. Foot comes back, but not nearly as far. Little bit of space between my feet, and I keep my right heel on the ground as I drop straight down toward the floor, staying upright and tall, feeling the stretch in my lower calf and lower Achilles area. Now, as we discussed, the bottom of the foot may be irritated and may not tolerate the weight-bearing stretches we just reviewed. And if that's the case, we're going to do a non-weight-bearing calf stretch with a towel. For this stretch, we're just going to take a bath towel, and I'll bring my right foot out. Just going to hook the toe area a little bit, somewhat of a straight knee, good tall posture, and I'm going to pull that foot toward me. Now, I'm not going to be able to get the differentiation between the gastroc and the soleus with this stretch, but again, if the bottom of the foot is that irritated, then I need to start here and just begin loosening up both muscles together. So this stretch I can feel all along the back of my calf here. Make sure your knee is not too locked out. If you have a locked out knee, you may feel it up the hamstring, and that's probably a nerve stretch you're getting, not a muscle stretch. If you're searching for treatment techniques, you'll often find a ball or a frozen water bottle that you can roll on the bottom of your foot. My preference as a manual physical therapist is to do this with my hands if you have the hip flexibility and you can tolerate a little bit of soft tissue work to the bottom of your foot. It's not too hard to do yourself. All that you need to do is place your foot up on your thigh, use a little bit of lotion, apply it to the bottom of the plantar fascia, the bottom of your foot. Remember, the heel pain is usually close to the heel, so you don't need to crank in and grind on that area. You can release the plantar fascia by working on the upper 2/3, and you can get a lot of relief from that. So a couple techniques I like to use are just some fingers placed side by side so I can gently come along. And when you first start, you might just want to investigate the arch behind the big toe, in the arch area. Remember, don't get too close to that heel, real sensitive area. Then the outer fifth toe area. If you find some sensitive spots, you can just spend a little time there. If it's more comfortable, you can back one finger up with the other, and that'll apply a little more force. And finally, using the knuckles and just kind of a closed fist is a good way to get broad contact and really get some lengthening in that tissue. Usually a good idea to do that for about 30 seconds, then move your foot around a little bit, give it a rest, and you can do 2 or 3 sets of 30 seconds, working up to several minutes if you can tolerate it. And finally, I promised you a stretch that most people have not seen. This is a calf stretch that involves your toes. The reason it's so beneficial is it will stretch your calf all the way down and will stretch your plantar fascia and the bottom of your foot all at the same time. Again, this is one of those stretches, if I could get patients to this stretch, it was usually the final stretch that got them over the hump and resolved their plantar fasciitis. So this stretch works well if you use a door frame. We're going to come up and we're going to place our toes a little bit higher up on the door frame, keeping our heel on the ground. Once I'm here, I can press down and you'll see my toes extend just a little bit. And I would do this with shoes on, it's a little more comfortable. Once I'm here, you don't feel much yet, but I'm going to slowly bring my hips up and I'm going to go toward the wall, almost like I'm going to kiss the wall. Once I get close, now I can feel a stretch all the way along the bottom of my foot, down around my heel, and up the entire calf region. This is a great stretch to tie it all together. Again, when you're setting up for this stretch, make sure you get your toes high enough. If I come in and my toes are real shallow, too low toward the ground, you'll notice I can't find the calf stretch part no matter how close I get to the wall. So you have to get your heel a little closer to the wall and your toes a little bit higher. Get the extension in the toes and then start to come in, and that is a beautiful stretch down the bottom of the foot up the entire calf region. I hope you enjoyed this video. Please let me know if some of these tricks helped you conquer this difficult, nasty, painful plantar fasciitis condition. And please don't forget to subscribe to my channel, hit the like button, and leave some comments. Let me know how things are working for you. I appreciate you tuning in, and we'll see you in the next video. Take care.